We found out that she had scoliosis at her 6-year-old appointment from her pediatrician, and he just sent us to go get it evaluated thinking it wasn't a big deal. And we were shocked when we were told it was about 46 degrees and we were looking at surgery.
When I met Alice Rose, her curve was at 46, and today when we took her cast off, her curve measured 33 degrees, so she's made a pretty sizable improvement.
We traveled to Dallas and did some research, and then we were at soccer, and I was talking to a parent on the soccer field, and he said, "Hold on a minute," and went and got his wife and came back, and it was Stephanie, and she said, "Well, I know Dr. Riley," and I said, "Well, that's not going to work. We've tried. It doesn't work with our schedule. We can't get in." And she goes, "No, hold on a second." And she picked up the phone and called him. And she said, "He's going to call you in 15 minutes. I was like, "Wait, excuse me?" And he talked to us for an hour. I was in tears in the backyard explaining our whole process. And Dr. Riley said, "Oh my gosh, we are going to fix your daughter. We're going to make this the best experience. And you tell me when you can come in and see us."
So when we spoke that morning, we talked about different options like bracing or just leaving the curve alone or casting. And casting is a super interesting technique because it's actually a very old technique that has experienced a bit of a resurgence in these last 10 years and has shown very promising results for very young patients with scoliosis that perhaps is a little more amenable to casting than the older patients.
We came in and saw him, and he spoke to Alice Rose instead of speaking to us, and that was one of the greatest moments. It wasn't about talking over her, it was talking to her about casting, and within that 2 weeks we had a cast on November 6th, and I think we met like October 25th, so it was pretty quick.
In order to have a cast placed, you still have to go to the operating room. You still have to go off to sleep, right, Alice Rose? So you were completely asleep, you don't remember anything about getting the cast on, right? You wake up and there it is. So they still undergo a general anesthetic, and then they wear that cast usually for about 2-month periods over a larger 6-month period.
It was just one of those serendipitous moments of being in the right place at the right time and someone hearing our story. So it worked out for the best it could possibly be. Getting her cast off was, we've been talking about this for months, and just seeing the progress and her strength that she's brought. I know as a 6-year-old I wouldn't have been able to be as positive. It's been pretty magical, and she's a tough little cookie, but Dr. Riley more than anything has showed us just appreciation and love and not just being a patient on the table.
The highlight for me in this whole thing has been receiving almost weekly video and photo updates of how Alice Rose was handling life in the cast. And I was getting texts with videos of her riding her bike, right? And doing a cartwheel and roller skating and doing all the things that a young girl her age should be doing.
The cutest thing was the day she went to school with her first cast. I was real nervous for her, and one of the little boys ran up to her and said, "Oh my gosh, you're more beautiful now than ever." And just sweetly, yeah, it was great. So Dr. Riley was an incredible doctor, but beyond that, he's an incredible person. Like, I never felt that I couldn't text and ask a question or my fears, or especially like the day before the surgery, it was like 500 questions to him, and what is she gonna do about this? He was like, "That's not gonna be a big deal," or whatever, and he made us feel just so much better. Everyone here has been amazing, and the staff and Dr. Riley's team and Dr. Riley himself, so yes. So I just thank all of y'all for taking such good care of her.